So today let's talk about matrescence. It's defined by the birth of a mother. This is a term that was coined by Dr. Dana Raphael in the 1970s, 1973, I believe. Interestingly enough, she's an anthropologist and also coined the term doula. So has been very influential in this space. And then the term was sort of in hiding or in secret for a while until in 2008, Dr. Orly Athan at Columbia University then sort of revived the term and gave it more meaning and sort of a broader definition. And really, it's this time of, you think about it rhymes with adolescence. So you think about the time in adolescence where there's all these changes that occur, right? There's physical and emotional and spiritual and relational and environmental and all these changes that occur in this time. And really, it's very studied. Like adolescent health is a whole medical area of expertise. There's a lot of information around what is happening during that sort of transitional period. Not enough, but of course, there's definitely quite a bit of research. Unfortunately, the same is not true for matrescence. So, this birth of a mother, this time of transition prior to even maybe thinking about having children or prior to pregnancy or even sort of planning going through the fertility stage and going through maybe even fertility challenges. It's all part of matrescence, and then going through the pregnancy itself and then postpartum. And so all these changes that occur in birthing person's life and experience all throughout that whole stage. So we don't have enough research, we don't have enough data on what happens. And there's, again, similar things. We have physical changes, we have relational changes, we have environmental changes, hormonal, societal, how we even present in society, right? All of these different mental, health and spiritual health and all these things that change during this time. And it's just so transformative. And yet we don't have a lot of data on what's actually occurring. What is that, all the effects that it can have on a person's life. So, it's really important that we talk about matrescence or patrescence, the birth of a parent, and we talk about how to support people in this space and how to provide information and provide care for people. Because if we don't really understand it, how are we going to be able to provide adequate supports and care? That sort of brings where we are at right now with maternal mortality. So, our country is, I alluded to this in the previous video, we have the highest maternal mortality rates in the developed world, which is just unacceptable. And what's fascinating to me, so we have these sort of statistics, right? These numbers, and when they look at the births during pregnancy, they look at the births during the labor itself, they look at the deaths during pregnancy, they look at deaths during the birth, and look at deaths during the postpartum period. And what they've found is that over 50% of maternal deaths happen in the postpartum period, not focused on the pregnancy. They're all not during pregnancy. They're not all during the birth, which when, of course, we're also focused in on making sure people have a healthy birth and a healthy pregnancy. And they have all of these visits and focus and care and information on that time. But then what happens in the postpartum period, you get that 1 6-week visit. And that's it. So that's just really, it's crazy. It's crazy that this is where our country is and our healthcare system is providing care and support. So we have this 1 6-week visit, and then this over 50% maternal mortality in the postpartum period. And then what they found is that over 80% of maternal deaths are considered preventable. Preventable. So if somebody had seen the patient, if somebody had laid eyes on them, if somebody had done an exam, if somebody had identified what was going on, we could have prevented over 80% of those postpartum deaths. Again, not acceptable. So, what do we do? Where are we at? One thing that has come up in the last month here is there's been a new study that looked at our maternal mortality rates, and it was published in the Journal for the American College of Obstetrics and Gynecology. And the authors suggest that the maternal mortality rates are actually lower than what the CDC had previously discussed or published on. And what's fascinating to me when you look at the study is that what they've done is that they've actually taken out one of the highest or the leading causes of maternal death postpartum, which is maternal health issues. So things like postpartum depression and anxiety and suicide and substance abuse disorders. We are removing one of the leading causes of maternal deaths and saying that our rates are actually lower because those don't count. And I argue that this is not unreal that they're even describing that this is not something that is actually killing mothers or birthers. Because I mean, then again, it's just completely discounting this idea of matrescence, right? So they're focusing in specifically on the physical changes that cause death and not all these other factors that are crucial in the transformation of people who have given birth and gone through this, sort of postpartum time. So they're completely discounting the fact that mental health changes occur, that the spiritual health changes occur, that people, how they present in society changes, how the environment, is affecting people postpartum. And now we're saying that this is not an issue as much as what has previously been stated, which I think is incredibly dangerous to state that this is not something, not as much of a crisis as it really is. I think it also really discounts the fact that systemic racism is killing our birthers in this country. Like, we have an astronomical difference in maternal mortality rates amongst our Black and Native population, and something that needs to be addressed and needs to be accounted for. And again, these rates that they're talking about in this study sort of discount that. So again, we need to be doing better. This is something that currently in the news and something that we should all be sort of looking at and discussing and reading critically into what this research is actually showing. Yeah, I just wanted to come back in and connect with you all and let me know if there's anything that you specifically have questions on, and I will make sure to post some videos. If you are in Minnesota, please reach out. I would love to be able to support you during your fourth trimester in the home. Otherwise, if you are located nationally, I also provide postpartum coaching services too. So reach out. We're here for you. Love to support you, and thank you for being here. Have a great day.